Okay, this is chapter 5B about atherosclerosis and hypertension with regard to preventing dementia. So we're going to go right to where we started before, but I just want to show a couple pictures to remind people some really key things, and then we'll keep moving forward. And we looked at this before, but it's real important. So here's the plasma membrane of the endothelial cell, the cell that lines arteries. Endo means inside. And there's these anchoring proteins, the core proteins that are attached to these repeating units of sugar structure like molecules. And the glycocalyx, glyco means sugar, calyx means coat, so the sugar coating on the outer surface of cells. And the way to think of it is like a bunch of trees sticking up from a hill, and they've got lots and lots of negative charges on them. The negative charges come from the sialic acids at the end. That's like a glucose with a carboxylic acid on it. It comes from the sulfates, heparin sulfate, for example, and cholesterol sulfates in there. And they attract water to them because water is a polar molecule. It has dipoles. That means partial charges positive from the hydrogens, and they're attracted to the negative charges of the sulfates, for example. And then they make the glycocalyx, the coating of the arterial lining, very, very slippery. And that helps the red blood cells and the white blood cells to travel through the capillaries. This is all going to be real important, and it's going to relate to a bunch of diseases. That's why I'm going over this real quick before we move on to more and more advanced stuff. The whole book is building towards more advanced stuff. I'm giving you the basic physiology. The joint cartilage is very similar to the glycocalyx. We talk about the potassium, sodium, ATPase. So K for potassium, N for sodium, kalium, natrium, the Latin for potassium and sodium, and how that establishes a negative charge inside the cell of about approximately negative 65 millivolts. Okay, and then it also establishes a chemical gradient of sodium being more concentrated outside the cell, and for that reason, you're going to then use this like a battery. That's the electrical energy of a cell, this electrochemical gradient. Electric because of the charge, chemical because of the sodium being more concentrated outside the cell. And that's how a cell gets work done. Okay. Sorry for zooming through all these, but and then remember the K factor. You need to eat a lot more potassium than sodium. Should be at least 5 is what Moore says, but really you want it to be at least 10. I think Moore went a little bit too soft on there. Okay, and our ancestors probably ate about 25. Then I wanted you to see this slide again because this is a money slide. And again, I'm sorry I'm flipping through all these slides, but you need to remember this. This is going to tell you how stuff happens inside of a cell. When the calcium concentration goes up, it activates the cell to do whatever cells do, like release their neurotransmitter, for example, in neurons. That's going to be a key thing. In vascular smooth muscle, it gets the muscle cell to contract. Okay, that's going to be really important. And when you eat excessive dietary amounts of sodium, you start to dissipate these gradients, get more sodium inside the cell. You urinate out, you void out this potassium from your body because the body has to balance its amount of cations, positively charged ions. And if you're taking in too much sodium, you're going to be pissing out your potassium, and you really don't want to do that. It's going to lead you to being hypertensive because you're going to stay having high calcium inside the cells. Okay, all right, so now we're back where we finished last time. Okay, so here's a new slide, a new picture here. And this shows what happens when you eat a high-fat meal. The first black curve is for saturated fat. Saturated fat starts coming up significantly in the blood. Okay, what this is based on, first of all, is the work of Peter Quo. He was a cardiologist in Pennsylvania in the 1950s, and he fed his cardiac angina patients a high-fat meal with saturated fat. So these are known coronary artery disease patients. And there was no, internal review board to watch his studies back in those days. You wouldn't be allowed to do this nowadays. And he would check the patient's blood lipids every 30 minutes, draw blood on them. And what he found was the lipid levels in their blood would rapidly go up after eating a high-fat meal with saturated fat. And in particular, by about 3 hours, it was pretty high. Stayed pretty high till about 7 hours. Okay, here's the peak around 5 hours or so. And the point was the patients would get angina. That means chest pain from the high-fat meal right when the lipids were highest in the blood, consistent with the lipids causing decreased oxygen delivery to the cardiac muscle. And then there was a big publicity about the dangers of saturated fat for coronary artery disease and causing heart attacks in the 1950s with all the work of Ansel Keys and the 7-country study. So then there was a big push in the 1960s to feed patients these omega-6 cooking oils, okay? And these are unsaturated fat. They're called PUFAs, polyunsaturated fatty acids, okay? And what they discovered was when you fed the patients PUFAs, their blood lipids were elevated for a more prolonged amount of time. And this was later done by Meyer Friedman and Ray Rosenman in the 1960s. They were ophthalmologists. And what they found was their lab workers, they would start out at, let's say, around 8 o'clock in the morning, and they got pissed off because they would have to stay late at night because these patients had persistent sludging of the blood, thickening of the blood. The chylomicrons will stick the red blood cells together. The LDL cholesterol will stick the red blood cells together. And so the PUFAs were even worse than the saturated fat. So that's an important observation. The PUFAs were bad. Okay, the omega-6 cooking oils had a very negative effect on their blood. Okay. Oh yeah, and Dr. Kuo also measured the oxygen saturations, and what he found was the patients had a 15 to 20% drop in the oxygen delivery to their tissues. Okay, that's a lot. Now, if you look at a hemoglobin oxygen dissociation curve, it's relatively flat at the top, so a healthy person wouldn't even notice that. A competitive athlete in the middle of competition would notice that their performance was a little off, but most of the people, they're not going to notice that drop. However, you get a sick old guy with a COPD, chronic obstructive pulmonary disease, and they might significantly notice an improvement in blood flow because they're already on the steep part of the slope. Roy Swank, in hamster brains, he was able to detect a 30% drop in oxygen delivery after feeding a high-fat meal to hamsters. Okay. There's other bridging molecules, and those include fibrinogen, the clotting protein, which is elevated during psychological stress or after eating caffeine or from sleep deprivation. IgM antibodies, which are elevated during an infection. Uric acid, which is elevated when you ingest, you drink large amounts of high fructose corn syrup. I recently made a video about uric acid and fructose, if you're interested in that. The chylomicrons after eating a high fat meal will cause sludging of the blood as well as elevated LDL cholesterol. Okay, here's a little bit about a normal peripheral smear of blood. It's mostly red blood cells, like over 99% of the cells are red blood cells. And the red blood cells are about 7 microns. The white blood cells are bigger, like about twice the size of a red blood cell, around 14 microns, for example. Okay, when you look at the blood in a test tube, it'll sediment out with the red blood cells at the bottom, and that's called the hematocrit. The white blood cells are in the center here, and it's often called the buffy coat. And then the plasma is transparent, and that's up above. And the higher the hematocrit, because red blood cells make up such a large percentage of the blood, about 45% of it, the thicker the blood will be. This is viscosity here. So the higher the hematocrit, the thicker the blood. The higher the LDL cholesterol, the thicker the blood. This is another explanation of why women live longer than men. Because women menstruate, they'll have a lower hematocrit, and that will lower their blood viscosity, so they're pumping a blood solution more like water rather than like a milkshake, and that lowers their pressure. Having a lowered pressure makes them less prone to developing atherosclerosis. Less turbulent flow at bifurcations, as we went through that before. Okay, now here is the picture of what happens when you eat a high-fat meal. The plasma becomes opaque from all the fat in there. Okay, so that's not good. If you watch that movie, The Game Changer, all about vegan diets with athletes, they showed this, the live thing. They took the blood from a bunch of athletes after they ate a high-fat meal, and you'll see that becomes more opaque. Okay, let's see here. Oh, the other thing, too, is if you get leaky gut, you can get the gram-negative bacteria. Also, the gram-negative bacteria have LPS, lipopolysaccharide. LPS right here is how it's abbreviated. That will be then able to get through the intestinal lining more likely, and that'll cause postprandial, meaning after eating, endotoxemia, because it's an endotoxin. It's bacterial endotoxin. So the gram-negative bacteria make LPS as their endotoxin. The gram-positive bacteria make LTA. That's lipoteichoic acid, okay? And they both are very prothrombotic and predispose the blood to clotting, which is not good. That can cause a lot of problems over time. Okay, if you're iron overloaded, that'll cause problems with oxidative stress potentially in the blood. And we talked about psychological stress, sleep deprivation, and caffeine all being quite similar, raise the same hormones, catecholamine and the cortisol, and they make the blood more prothrombotic. Increased fibrinogen, clotting protein, as well as factor VIII, antihemophilic factor. That's a clotting protein, von Willebrand factor, and they cause platelet activation. So you can see a lot of things move in a bad direction. Like a really terrible meal would be to eat, let's say, some pizza. It's going to have all the greasy oils on it. It's going to have all the saturated fat from the cheese, for example, potentially the meat if there's sausage on it. It's going to have a lot of sodium on it, a vasoconstrictor. And then you drink the soda pop with caffeine in it. That's also a vasoconstrictor and prothrombotic. So all this stuff starts adding up, and a lot of people, have those types of habits on a routine basis. Okay, the next thing we're going to talk about here is myeloperoxidase. So myeloperoxidase is released from the neutrophils, and it's in response to inflammation. It can be used by the immune system. We'll talk about that some other times, but it can be used by the immune system to produce chemicals to kill bacteria. Okay, so that's why we have it. But when the myeloperoxidase, MPO is how it's abbreviated, is released, it can do a lot of things you don't want. It'll distort the shape of some of your red blood cells, and it will also cause a collapse of the endothelial glycocalyx. It'll overcome the endothelial glycocalyx zeta potential. So that's all bad. And remember, it's fiber that maintains the gut lining. When you don't have dietary fiber, you tend to get leaky gut. So here's a picture of some of the things that can happen after eating a high-fat meal. The fat tends to activate the neutrophils. NP is for neutrophil. When they're activated by the fat, the neutrophils will release these little plus signs right here are the MPO, the myeloperoxidase. And they're very cationic, meaning they're very positively charged. Well, they will interact. Here's a normal glycocalyx on endothelial cells, so lining your arteries. And the endothelial cells have a zeta potential, these negative charges. Deep beneath them are, blood cell binding proteins, but these are normally hidden, because they're just not as tall as the core proteins coming out of the endothelial cells for their glycocalyx. And again, this negative charge attracts water, makes it slippery. That's all good. But when the neutrophils are activated, they release MPO, myeloperoxidase, on top of the glycocalyx of the capillaries of these endothelial cells here, and they will cause the endothelial cells, the glycocalyx, to collapse down. And when the glycocalyx collapses down, those core proteins collapse down, then these blood cell binding proteins binding receptors become exposed, and they will bind, for example, the neutrophils. And this can progressively lead to leaks in the endothelial cells, tight junctions. It can also cause clot formation, predisposed to beginning clot formation and causing atherosclerosis. So it's bad. You don't want this to happen. So excessive dietary fat can make that happen. Okay, there's a whole bunch of papers on this sort of stuff. Here's another paper. A single high-fat meal provokes pathological means abnormal, disease-causing, erythrocyte's a red blood cell, remodeling, changes in shape, and increases in myeloperoxidase levels. Implications for acute coronary syndrome. That means for causing a heart attack. Okay, high-fat meal, chronic high-fat feeding in mice induces RBC changes in shape, and this has been shown here in different populations. Following the high-fat meal, the blood triglycerides, cholesterol, and free fatty acid levels were all significantly increased, and there was impairment of postprandial flow-mediated dilation, FMD, flow-mediated dilation. So, the secret of being healthy is maintaining good blood flow to all your tissues. The reason all these old people are sick is because they have poor blood flow to their tissues, and that makes it hard for you to heal anything. You want to heal anything, you want good blood flow. Okay, so this is just showing what a high-fat meal. So here's normal red blood cells in what is called a discoid shape, little indentation in the center. They're very, very flexible. You can get some small ones called microcytes for small cells. In particular, what we're interested in here is you can get acantho. Acantho means like a thorn, so these little spur-like projections from the red blood cell. And you can get echinocytes. Echinocytes, just remember E for echino and E for echinids, like the animal. There's spurs all over, circumferential, relatively symmetrical. And again, these are going to be less able to travel through capillaries and deliver oxygen as effectively. Okay, Western diet induces blood-brain barrier leakage, and so that's bad. The same things that cause leaky gut will tend to cause leaky blood-brain barrier. And it goes backwards too. Things that cause leaky blood-brain barrier will tend to cause leaky gut. Like when somebody has a stroke or when somebody has trauma to the brain, that's the thing. Neurologists don't know this. They really ought to know this, but they don't know. No doctors are taught about nutrition. I never met a doctor in my life that learned about nutrition in medical school or residency. So when somebody has a stroke or traumatic brain injury, you've got to be extra careful to eat a high-fat diet and avoid things that cause leaky gut, because that could lead to, through the leaky gut, toxins getting into your blood, and then through the blood-brain barrier leakage, having increased access to the brain. So it's good to be aware that those things go together and they're relevant. So if you want to get, better preservation of the penumbra, that means the tissue around the injured area, let's say the stroke, you want to maintain an intact blood-brain barrier and an intact gut. So this is just basically showing fed the high-fat diets, they would have a tendency to develop hippocampal blood-brain barrier permeability. But that's really bad because your hippocampus is your memory center. And so if you're having blood-brain barrier increased permeability at that location, that means more toxins are getting access to your hippocampus and potentially going to damage those neurons. You can also get blood clotting proteins get through there, okay? This is a real quick slide. Some of you might have seen this before. I'll go over it real fast, though. This is like the work of Dennis Burke. He was the Irish Christian missionary surgeon who worked in Africa for many years. And he observed the differences between the plant-eating native populations versus the persons who sort of brought their westernized diets to Africa. And what he saw was the persons eating the plant-based diets, they would get none of these diseases. All of these diseases come from constipation. So it's called abdominal pressure syndrome because fiber from plants adds water to the stool. It attracts water to it, and it makes the stool liquefied. And when you poop, a plant eater, when they poop, it's like a cow patty, versus meat eaters who don't get much fiber. When they poop, it's like a dried out Tootsie Roll, and they have to push harder. Straining your abdominal muscles to pop out and pinch a loaf, that's called Valsalva maneuver. And the Valsalva maneuver of tightening up the abdomen to do that causes back pressure. The back pressure from the rectum is transmitted into, well, first of all, into the rectum locally, into the veins, and it causes rectal hemorrhoid veins. Those are dilated veins which sometimes bleed. The back pressure also is transmitted into the sigmoid colon, which is the part of the colon that connects to the rectum. And the back pressure will cause outpouching of the colonic wall. That's called diverticulosis. If one of those diverticuli pops, it'll leak stool onto the abdominal fat, the mesenteric fat, and that's called diverticulitis. And I can tell you, I see a patient get admitted every single day. All the Western hospitals have typically at least one admission, usually for diverticulitis every day. It's very common. And sometimes, you can treat it with just draining the abscess, but a lot of times too, they end up surgically having to have their sigmoid colon surgically removed. Okay, you don't want that if you don't have to have that. Okay, what else? The back pressure can be transmitted to the stomach, and it'll cause the top of the stomach to pop into the chest. That's called hiatal hernia. It's very common. And the hiatal hernia will often have gastroesophageal reflux, so acid reflux, get senses like a heartburn, discomfort, and over time this mucosal lining, the lining of the stomach esophagus at this level will change to something called Barrett's esophagus, which is a premalignant form, and that will eventually increase the risk of getting esophageal cancer. Cancer in the distal esophagus used to be smoker-drinker cancer. Squamous cell carcinoma was a type of cancer. Now it's more of an adenocarcinoma related to all this hiatal hernias and gastroesophageal reflux. There's the abbreviation GERD. So again, this is all from eating a low-fiber diet. Because the stool's dried out with the low stool diet, the meat and processed food diet, you'll sometimes form little rocks of stool called appendical lith. Lith means stone. In the appendix, there's a location of it, and that'll block the connection between the appendix and the cecum, and that will cause then back pressure because the mucus-secreting glands in the distal tip of the appendix continue to produce mucus, and eventually it'll pop and leak stool all over the abdomen. In addition, the constipation causes back pressure on the veins going into the scrotum, and that's called a varicocele. And that can cause infertility because it heats up the testicles. So like I said too, the old thing was a young guy telling me, you tell me I can become infertile because I'm constipated? And the answer is yes. Okay, the back pressure is transmitted into leg veins, and that causes varicose veins in the legs. Okay, so it's good to know because women especially don't like getting varicose veins. the main thing that prevents leaky gut is the short chain fatty acids, and those are made from fiber. So fiber is wonderful. It not only prevents leaky gut, by preventing leaky gut, it also works on the blood-brain barrier, and it prevents leaky blood-brain barrier. So that's another reason why a plant-based diet will make you more intelligent, because you'll have a more intact gut barrier and blood-brain barrier. Okay, now I'm going to show you something about some normal variants that are good to know about. And this will help you understand philosophy of disease. You really want to understand philosophy of disease and theories of disease. When I say these things, I think they're really important, because a lot of people, they're real mentally weak and they can't make up their mind to do anything because they're ignorant. But if you understand some of this basic stuff, it becomes obvious why it's a good idea to pay very close attention to your diet. Okay, this is the circle of Willis. This is the normal anatomy at the base of the brain. Here's the ICA, means internal carotid artery. It comes up into the brain, and then it bifurcates. There's an anterior cerebral artery going anteriorly. There's a middle cerebral artery going out to the side. Then the posterior circulation is referred to as these vertebral arteries come up, and they feed into something called the basilar artery. So here's the basilar artery. Now we're sort of looking at it in cross-section. Now you'll sometimes see connecting arteries between this is called the anterior circulation coming off the carotid. This is called the posterior circulation coming off the vertebrals going into the basilar. Okay, the relevance is that you'll sometimes have connecting vessels, and they're called the posterior communicating artery. They're usually abbreviated PCOM. Sometimes, in the embryo, these PCOMs are really big, and then usually they sort of atrophy and shrink down. But sometimes they persist into adulthood. And it's a relatively common normal variation. I see this typically every day, at least one of these every day. So what's the relevance? Well, if the persistent fetal PCOMs, stay into adulthood, as they often do, then typically the vertebral basilar system, arterial system, is going to be very hypoplastic, very small. Well, if you have a very small basilar, then you're predisposed to forming little clots along its surface from atherosclerosis. Remember, atherosclerosis is a blood clot. And it'll have little penetrating arteries that go into the brainstem. So what I'm basically saying is if you have this type of anatomy, and a lot of people do, you're predisposed to having a brainstem stroke. And the reason why you don't see this in indigenous populations that eat their old-fashioned diets is because if you eat a plant-based diet, you don't get any of these problems. Okay, so we showed persistent fetal PCOMs associated with hypoplasia of the vertebral basilar system. The basilar artery runs on the front of the pons and runs in front of the MB for midbrain. This is your brainstem here. Here's your cerebellum. Okay, so what I'm saying is you're going to form little atherosclerotic plaques and clots in this artery. That's normal for that to happen, and normally the body can handle it pretty well. But when you got a small basilar, it's at increased risk to occlude the little penetrating arteries that go into the pons and also some of its branches that will supply blood to the cerebellum. And so these patients have a higher risk of pontine strokes and cerebellar strokes. And you don't know if you got this. None of us knows this unless we've had a brain MRI where somebody looked at the flow voids, or an MRA or CTA or something to look at these vessels. So what I'm saying is the wise move is just assume you've got it. You probably do have this or some other similar type of normal variant elsewhere in your brain or in your heart. And once you realize that this could easily be you, it just shows why it is wise to be very careful about your diet and stick to it, the healthy, low-fat, low-sodium, plant-based diet, so you decrease your risk of having a stroke, okay? All right, now here's a normal variant, kind of a similar situation in the heart. So in the heart, usually you'll have a bifurcation of the left main coronary artery into the circumflex and the left anterior descending. And this is the one when you get stenoses and occlusions there, they'll call it the widowmaker, and they'll rush the patient to cabbage or something, coronary artery bypass graft, open heart surgery. But what I'm saying is you could have a normal variant here where you have a trifurcation of the left main coronary artery, and you have a ramus intermedius branch. And what that means is if you got two branches, they're going to be relatively large in diameter typically, meaning easier to bypass, easier to stent. On the other hand, if you have a trifurcation, these are going to be smaller. It's going to be a little more technically difficult to effectively stent a smaller artery and get a good long-term patency. So this just works against you a little bit, okay? And again, you don't know if you got this anatomy. Nobody does unless they've, had the cardiac cath or a CT angiogram of the arteries. So again, it's wise to assume you might have this. Another little point about coronary anatomy that's real important to understand is when somebody does a stent, like let's say there's a stent in the circumflex placed by a cardiologist, or they put a stent in the left anterior descending, all they're treating are these epicardial arteries. So epi means on top of, cardiac is heart. So the epicardial arteries, they're the big arteries on top of the heart. But they don't include the little arteries that go into the muscular branches. These are the penetrating arteries. These go into the muscle of the heart, the intramuscular arteries, okay, intramyocardial arteries. And the relevance is you get atherosclerosis, you form blood clots in these vessels as well, but you can't treat them at all with a cardiac bypass or with a cardiac stent. And the only thing that's going to reach these things, you can treat them something with pills, statins and dual antiplatelet therapy, that sort of thing. Or the best thing is going to low-fat, low-sodium vegan diet, and that's how you reach all these areas. Because you can get a lot of heart disease and even have a heart attack just from plugging up these smaller branches. And you can get those fibrinolytic amyloid clots going into these vessels. There's a whole syndrome called microvascular angina. Oh, one last point was a patient could have a lot of disease in the myocardial branches of the coronaries, but not much in the epicardial branches, and have a totally normal cardiac cath or CT angiogram. So it's a little more common in women to have that, but the point is made that it's not just the epicardial coronary arteries that are the major issue. It's also these intramyocardial branches, okay? So here's just one paper talking about the same thing, coronary microvascular dysfunction. And you'll sometimes hear this called coronary syndrome X or microvascular angina. And listen to this, here's a typical academic article. The optimal treatment for this cohort is undefined. Basically, they're saying we don't know what to do with these patients, okay? And it has a substantial morbidity. They see it in a significant number of patients that undergo coronary angiography. It's an important thing to know about. Pills don't work that well, not at all. Angioplasty, stenting, okay. And then what about the Esselstyn diet? Esselstyn diet is the best thing to do, okay. And they say in general, this coronary microvascular disease has a poor prognosis with risk of sudden cardiac death, myocardial infarction, heart attack, and congestive heart failure. Okay, so here's some more of the risk factors. Like we said, postmenopausal women are prone to this. People with autoimmune are prone to this, and they can form little clots that plug up those vessels. All right, infections can form amyloid clots that damage these things as well. The work of Douglas Kell and Etheresia Pretorius on that subject was real interesting. I made some lectures about that, amyloidogenic type clotting. Okay, so they're real vulnerable to all the microvascular disease stuff like diabetes and whatnot. Okay, and of course, here's, the Dr. Caldwell Esselstyn book, and it's a great book. And what he basically shows is that somebody sticks to his diet, low fat, low sodium, plant-based diet, no meats, no sweets, no oils, no caffeine, they can do really well. If somebody follows a diet, most of them never have another coronary event. In a 4-year follow-up, though, all the ones that followed it didn't have a recurrent coronary event. He mentions one patient who did have cardiovascular event, but that was a patient who wasn't following the diet. So it's a great book, and you don't need to buy these books. Almost all of these books, you just go watch the videos. You can watch all his videos online for free. If you want to buy the book, it's a great book, but just know too, if you're on a tight budget, you can get this information by watching the videos. Okay, Esselstyn's real strict about not any oil at all. Okay, here, and I got a couple quotes from Esselstyn. He says, coronary artery disease is virtually non-existent in Tarahumara, Papua New Guinea, Okinawa, Central Africa, and rural China. Yeah, it's non-existent in any traditional plant-based eating population. Nitric oxide is the most powerful vasodilator in the body. Nitric oxide is the life jacket of your arteries. The number one goal of good arterial function is to maintain adequate amounts of nitric oxide. As we get older, our arteries produce less nitric oxide, but the body has another way to produce nitric oxide, to get it from plants. Eat green vegetables at every meal, and this will help to keep your arteries bathed in nitric oxide. Yeah, he hangs out with that Nathan Bryan nitric oxide expert guy, and he's even recommend for the really high-risk patients to eat greens all through the day to keep on getting the nitrates. I'll show you a little more about how that works. Okay, so here's how you get the nitric oxide from eating greens. So when you eat the greens at first, that's NO3, called a nitrate. So it goes into your mouth right here. Then on the back of the tongue, you've got bacteria that will convert the nitrate into nitrite, NO2. Okay, so that's also why you don't want to brush your teeth with F- toothpaste or use F- mouthwash or something, because it'll take out these bacteria on the back of your tongue, and then you won't have them available for converting your plant nitrates into nitrites. Okay, then it goes into the stomach, and the stomach acid helps to convert it from NO2 to just NO. That's nitric oxide. Okay, so PPIs, which block stomach acid, can also decrease your ability to make this work. Okay, and then it'll travel in your blood and it'll cause a systemic dilation effect. You also get a systemic dilation effect from sunshine, which activates nitric oxide precursors underneath your skin, and that's partly why when you walk out in the sun it feels so good. Okay, now here's a kid, a drawing, one of my kids made this drawing, and I thought it was kind of funny. It's kind of like the Michelangelo painting of God creating Adam. Okay, so I got Caldwell Esselstyn with his son Rip Esselstyn, and the reason it's kind of funny is that I joked that Esselstyn's kind of like an Old Testament God. He doesn't, whimper around and say, oh, you can have a little bit of oil or you can have a little bit of nuts. No nuts, no oil, no BS. Because you want stuff to work, okay? And he kind of comes from a surgery background, which I think is good. So surgeons tend to be more stronger in their opinions. It's more valued in the surgical community to be very definitive in your statements and confident in your statements. And it works better. So don't mess around. Moderation doesn't work. When you tell somebody, you can do a little this, a little that, they end up just screwing up and they don't get good results. And it's the same thing. You don't tell an alcoholic you can drink on the weekends, you tell them no alcohol. You don't tell a cigarette smoker you can smoke on the weekends, you tell them no cigarette smoking. And that's real important. Okay, so anyways, that sort of firm Old Testament-like attitude for this is good. Old Testament God says, obey my commandments or I will kick your ass. Okay, and that's good in this context. So for nutrition and health, that's what you want. All of these people, who've made incredible results, most of them, they're really pretty strict about following their diet, because it's what you do every day that has the biggest effect. Okay. I also was making the point that sunshine also will increase nitric oxide. It increases vitamin D, of course. It also increases the sulfates. It's a long story, but it'll increase availability of sulfates for having a good endothelial glycocalyx. We're definitely designed to get a lot of sunshine. And it's much, 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 much better than taking your vitamin D as a pill to get it in the sun, from the sun. Okay, here's a picture of an atherosclerotic plaque. And the real question is, how much of this is reversible? Remember, we talked about it. It's like a blood clot. So there's a component of it that's this dead cellular material, that's necrotic core. That can be totally reabsorbed. So that's reversible. There's a lipid core, which is a lot from the plasma membrane and phospholipids in the red blood cells, for example. That can be reabsorbed. All right. Usually there's a more acute part of the clot, but when you'll often see in an old atherosclerotic plaque these calcifications. That's not going to change. Calcifications don't change. That's irreversible. You'll see fibrous tissue when you look at it under a microscope, and if it's still highly cellular, meaning it's relatively young fibrous tissue, that can be partially reversed. Okay, but if it's old fibrous tissue that's relatively acellular, that's not going to be reversed. But you can often get a big improvement in flow because the equation for flow is over r to the fourth of the diameter. So if you just get a small increase in diameter, you can get a big increase in flow, relative to r to the fourth. In addition, as soon as the cell starts becoming healthier, the endothelial cells will make more nitric oxide. So you can get vasodilation, a very fast onset result, just within days from reducing the dietary fat and salt. And then it'll take a little more time to more fully reabsorb the plaque itself. But the good news is it is largely reversible. And, that's been shown with Ornish's work, Dr. Dean Ornish, and SPECT scans. That's been shown with cardiac caths and the work of Esselstyn. And McDougall's seen that before on cardiac caths. And Nathan Pritikin mentioned seeing some of that. And there's also these animal studies like with monkeys, they've shown that, reversibility of atherosclerosis to some degree from eating very low-fat diets. Okay, there's other, I got a bunch of lectures of this on my YouTube channel. There's plenty of lectures, at the other famous vegan YouTube channels. William Roberts' videos are also good. Okay, just one more picture again from the work of Walter Kempner. Here's a work of Walter Kempner where he showed, here's a normal retina. And then here's a patient with, like hypertensive retinopathy, diabetic retinopathy. They get all kinds of problems in there. And when he would put his patients on the low-fat rice diet, rice is only 1% calories from fat, they would often reverse the appearance of their retinal exam. So that was quite impressive. They also showed reversal of EKG findings quite often, indicating a reversal of coronary artery disease. Yeah, here it is. Dramatically improved EKG findings, chest X-ray findings. It's rather extraordinary. Dr. McDougall said, in his opinion, Dr. Chptr was the greatest doctor who ever lived. If you go to Dr. McDougall's site, you can see the actual research books that Chptr himself wrote. If you want to read a good biography, the biography about him by Barbara Newborg is quite good. It's a little bit gossipy about all the people involved, but it's also good on the science. She was a doctor who worked with him, was like his assistant. Okay, then here's a little bit of a joke. Okay, so this is the story of, atherosclerosis is what causes impotence. Usually it's the most common cause. You plug up the arteries to the Johnson, and then you can't get an erection. So this is the resurrection of the Johnson of Lazarus. Okay, so lots of patients, once they go plant-based, low-fat plant-based, to open up their coronary arteries, they find that the Johnson starts working again a lot better. Okay, so good to know. Okay, yeah, and by the way, I'm not going exactly by the book. I'm just telling you the stuff that I think is most important for you to know. The book's got more nuance and jokes and all that kind of stuff in here, but, in terms of like key stuff, I think, is to understand these pictures. So I'll talk a little bit about stress level, and what this is all about is something called the Yerkes-Dodson curve of stress versus performance. If you're not motivated and a little bit stressed, a little bit excited to do something, then you're going to be sort of half butt. You're going to not have the energy. You're going to be inattentive, unmotivated. You can't really do much in that type of mindset. Versus the optimal mindset for peak performance is to be enthusiastic, to want to do the activity, healthy, interested, curious. Okay, challenging but comprehensible. A Krashen definition of good. Okay, known plus one, meaning just a little bit beyond what you can do, sort of at the edge of what you can do. Anyways, that's what you want. If you're too anxious and stressed out, then your performance will suffer. But anyways, that's a Yerkes-Dodson curve for performance related to stress. Okay, here's a nice slide. This is the story of the life cycle of the sea squirt. So a sea squirt, when it's young, a juvenile, it has a brain and it swims around. Remember we talked about if an animal moves around, it needs a brain to be able to see where it's going, to make value judgments, to navigate away from obstacles, to remember how to get back where it came from. So that's the juvenile phase of the sea squirt. But when the sea squirt's an adult, it attaches to a rock, becomes a filter feeder, and its brain is reabsorbed. It gets recycled. If you're just going to sit there attached to a rock, you don't need to have a brain. So same thing for humans. One of the best things you can do to keep your brain functioning well is to exercise. Exercise does lots of good things for the brain. It's one of the best things you can do to maintain brain function. We joked about Voltaire, why do animals have brains but plants do not? Because animals move. The purpose of a brain is walk down a path in a forest or a jungle and to survive. Oh, one thing I forgot to mention when we looked at that slide earlier that showed the cerebellum on it, if you count the number of neurons in your brain, it's about 100 billion, okay? And where do you think most of them are? 70% of them. They're in that little cerebellum, and why would that be? Because you got all these short-length little interneurons that connect other neurons to each other, and they're very useful for making subtle, nuanced movements, like writing with a pen. All kinds of things that only humans are good at doing. Okay. Other benefits of exercise. Let's see. We're going to go into these now, or I don't know if I go into them later in the book. Oh no, that's a whole new chapter when I talk about exercise benefits for the brain. So anyways, what I was hoping you'd get out of this was just recognizing that if you want good blood flow, as you do to maintain good brain function, you want to minimize dietary fat, minimize dietary sodium, and you want to prevent leaky gut. All those things will lead to poor blood flow, okay? And these same things that make your optimized brain function, they also optimize immune system function. So anyways, hope that was helpful.